everyone for joining this. So there's a team of us here from City Osteo and Physiotherapy and the City Sleep Clinic. And, you know, there's a number of practitioners that we have, and we were having discussions, and actually there's two areas, both breathing and naturopathy, where we realize there's a real crossover or link, and that's in treating asthma. And so this talk specifically is about treating childhood asthma, using two of these complementary areas, so breathing in the form of inspiratory muscle training, as well as the field of naturopathy. So if we just go to the next slide, we've got two awesome practitioners who are part of the City family. So we've got Joel Simpson, who's going to kick things off. Joel is a sleep and breathing therapist, and I'll let him kind of take it away after this. So Joel's going to do the first section, and then Alicia's going to wrap it up, talking about how you can use naturopathy to help with treating childhood asthma. What we'll do is there's a chat on this, and so if you guys have questions as we go through, please, you know, put them through the chat. We probably won't take questions during the course of it, because one, some of the questions will hopefully be answered, but two, then we can get to the end and really have a good discussion at the end. But as soon as you think of a question, put it into the chat. We'll be logging them, and then we can go from there. So I'll hand it over to you, Joel.
Thanks very much, Meg. All right, guys, thanks very much for joining this beautiful Tuesday morning in Singapore. I give you a little bit of a background on me. So I've worked in breathing training and, as Meg said, sleep therapy for around 10 years now. I've worked in Australia mainly, and then, you know, more recently up here in the City Sleep Clinic and with City Osteo Physio in beautiful Singapore. My interests really are around, you know, breathing training for clinical populations, so people with asthma, young people with asthma, and hence why we're doing this talk today. And then obviously sleep disordered breathing, so breathing issues that patients have while they sleep. So I'm going to kick off with a bit of a summary of what I'll be talking about today. So as I mentioned just then, asthma and inspiratory muscle training. So how muscle training of your breathing muscles, which we can train, a lot of people don't know that, and how that improves symptoms for patients with asthma. I'm going to quickly run you through the classifications of asthma, some of the typical medications that, you know, if you're an asthmatic or your child in particular might be using, asthma action plans, and then I'll jump into the things that I'm more of an expert on, which is the exercise and inspiratory muscle training. So those first three topics are really on the medical side, and yeah, just wanted to kind of highlight that, you know, this is a conversation around what we can do in terms of exercise, in terms of muscle training to help asthma, but by no means is this, you know, at all any sort of replacement for the conversations you're having with your general practitioner or with your respiratory physician. So we have, once kids get to a certain age, we like to classify them by the amount of symptoms that they're having. So, and it is a bit of a scale, a bit of a linear scale in terms of, you know, some people have progressively more exacerbations, events, you know, and we look at how many times they're using their reliever. So we have, you know, for example, a young person might be using, you know, a temporary reliever, and they might be coughing at night time, and they might be short of breath a few times a week. Now, what we do is we put people into these categories and put young people into these categories so that we can better understand, you know, when they're more likely to have symptoms and what kind of therapy, you know, we need to prescribe for that person. We look at younger kids a little bit differently because sometimes when kids are getting into adolescence, they tend to not so much grow out of, but they tend to see less symptoms, you know, as they get older often, and potentially having less inflammation and things like that. Now, with young people, what we know, and what is pretty obvious, is that their airways are smaller. So if they're having inflammation and there's things going on, with a reaction with asthma, they are going to experience more of a occlusion of their airways, more of a restriction in their airways because of their smaller airways. Okay, so as they get older, then we can start to classify them more correctly and into those baskets, whether it's mild, moderate, or severe, or if they have intermittent asthma, which could be, stimulus induced. So potentially they've also have some allergies, potentially, some sort of new environmental factors, or exercise, or exertion could cause possible exacerbations of their asthma. So we'd put those into the intermittent category. And then we jump to mild, moderate, and severe, where obviously mild is less symptomatic, they're having less use of their reliever. Moderate, again, it's a gradual increase. And then severe is somebody that we're really worried about in terms of being high risk of being admitted to hospital, high risk of having exacerbations, asthma attacks, basically. Okay. Okay, so what are the common medications and what they do? So generally what we see is most patients, particularly those that are on long-term use, so are having, regular symptoms, regular exacerbations, that generally will always put them on a maintenance therapy, and your GP, your respiratory physician, will always prescribe inhaled corticosteroids, or as we say, ICS, and then long-acting beta agonists, which is a dilator. Okay, so they both produce their own benefits. The corticosteroid obviously is an anti-inflammatory, where it treats the inflammation of the tissue of the lungs, and the long-acting beta agonist is dilating that smooth muscle that's in the lung. So it helps open up the airways so that we can breathe better. And then reducing the inflammation helps us, transport the oxygen. It also helps us breathe better because there's more of an open airway and more oxygen, more air is able to get into the lungs. And so most medications are a combination therapy. So so the maintenance therapy will be that inhaled corticosteroid in combination with the long-acting beta agonist. And that's where you see brands like Seretide or Symbicort. And, there's a few other ones around, that young people might particularly be using. And generally, we'll put those at lower doses for younger kids, or the GP and respiratory physician will put them at lower doses. Then we have the short-acting beta agonist, and that is, in Australia we call it Ventolin, but it has different names and different brand names, wherever you are throughout the world. That is really a short-term fix. Okay, so these puffers, they only last for 4 hours, generally speaking. So they don't keep your airways open for a long period of time. And that's really kind of what we need to be doing for our kids. We need to help them, be able to breathe better. Okay, and so if we're just putting Band-Aid solutions by just opening up the airways short term, we're not really doing much to help improve that underlying condition. And really what we say, and one of the respiratory physicians I used to work with in Australia used to say, is that if we're not treating patients with inhaled corticosteroids when they're symptomatic, then we're actually doing long-term irreversible damage to their lungs. And he described it as an equivalent of if you go a day without taking your inhaled corticosteroid while you have symptoms, then you may as well smoke a pack of cigarettes on that same day. That's pretty much the equivalent in terms of long-term effect that we're, doing to the lungs. Okay. So again, this is all stuff that you need to be talking to your GP about. This is all stuff that you need to be talking, if you have a respiratory physician that you talk to, that you're consulting with for your kids. And I'd highly recommend, bringing up what medications they're using, what you guys can be doing better as a team, to help improve, particularly if your kids are symptomatic and they're struggling, with their asthma, whether it's with exercise, with daily life, and potentially even having attacks and frequent exacerbations. So that brings me to asthma action plans. There's really no substitute for having a good, strong asthma action plan. Now, what is an asthma action plan? Really what it is understanding the category. So understanding where your child is in that scale from, mild to severe asthma. And then having a plan and understanding the risk of asthma attacks and having a plan to intervene early. Okay. So that really means that we need to understand everything from their symptoms, when they're having symptoms, what kind of symptoms that they're having, when does it get to a point where we need to change medication? When is it a point where we need to go and consult the GP? When is it at a point where we need to go to a respiratory physician? And at what point do we need to go to the emergency department? Those are really important steps that you really, can't manage a child's asthma effectively if you don't have that in place. And that it's not a difficult task, and most GPs will have a really good framework for that for you. I think having that there also gives you peace of mind, and it gives you a step-by-step playbook for what you need to do in certain situations. Okay. What happens if my child starts having an asthma attack when they're swimming? What happens if they, have a severe, sinus infection or something like that? Like what's happening to their asthma when these other things that are influencing their respiratory system start happening? Okay. So these are the things, these are the questions, and it's really about having a plan, like a risk plan. I mean, a lot of people in their work, they have these, risk mitigation plans. It's no different to that. And I think that's what we really need to focus on when we develop these asthma action plans. But the first step really is talking to your doctor about it. So what you have already, you might have prescription medication, but it's like, okay, well, what's our asthma action plan? What are we doing in different situations? When does medication change? When do we potentially reduce medication? Okay. Because it works both ways. Like if you're worried about how much they're using, one thing I would say when it comes to medication, I get this question a lot, is, okay, well, when do they get to go off the corticosteroids? When are they going to go off these medications? Because, surely they have long-term side effects and things like that. Sure, like there's not a lot of evidence to show that inhaled corticosteroids at these doses produce long-term side effects. But what I would say is that it is far worse for a child to end up in the emergency department and then on a prescription of oral steroids. So the dosage for oral steroids for a week is around about the same as taking your inhaled steroid for 2 years. Okay. So asthma and exercise. This is a really interesting topic. There is a bunch of research around things that we can do. And generally it's around management. Most kids will kind of know when they're going to get short of breath. They'll know that they'll need reliever usage. And this is where the part of the short-term reliever really comes into play, I guess, more for young kids. I think what we really need to understand is that sometimes for children, they have inflammation in their lungs, and even adults, to be fair. We don't know that we have inflammation at a lot of levels. Like, so we have this inflammation and symptom onset delay. So you'll have inflammation in your lungs as an asthmatic and you won't know. You won't be symptomatic for at least a period. It's only when under exertion or when the inflammation gets to a point and then you're like, oh, okay, now I feel short of breath. And then by then, the inflammation's already enough that it's hard to reduce. So we can't quickly reduce that inflammation with inhaled corticosteroids because it's already at a point where, it's going to be a little bit tricky. It's going to take some time to reduce that inflammation over time. So if they stop using, particularly when we have big sporting events or sports carnivals, we are going to see, we're going to find it difficult to get your kids less short of breath if they haven't been taking their inhaled corticosteroid. And so exercise is a true kind of indicator. It really does bring out those symptoms if we do have an underlying inflammation, and that could be even mild. Change of seasons is a typical one. I mean, we don't see that too much in Singapore, but in other countries for sure. change of season, then onset of sport. So they start playing, football or, whatever it is in the winter. And they've just, come off the back of summer where it's not, they're not as bad or symptomatic. And then all of a sudden they're a lot more short of breath. So having an understanding of your maintenance therapy and how it applies to sport is important. And then how to use your reliever medication during exercise. Some really good things to look out for your kids. What is not normal during exercise, okay? I don't ever want to hear parents say, oh yeah, they're coughing and whatever, but that's because they've got asthma. No, that means their asthma is uncontrolled. That means that we do not have a good grasp of what's going on with their asthma, okay? Coughing, regular coughing, I mean, if they cough once or twice, during an hour-long exercise session, then, not a problem. But if they're regularly coughing, regularly short of breath with exercise, if they're wheezing, or if they indicate to you that they have tightness in their chest, those are some key markers. That is not normal. That means that your child does not have their asthma under control, okay? Good. All right. So I'm going to move on to inspiratory muscle training. So this is the stuff that I think is one of the single best things that anyone with any breathing condition could do, in terms of it helps with lifestyle, quality of life, it helps with breathing. But what it isn't a replacement for, it's not a replacement for medication. It's not a replacement for other, like dietary factors and some of the other stuff that we'll be talking about and Alicia will touch on later. It is an adjacent or an adjunct, an addition, an additive therapy that we can add to our overall plan for our child. So what is it? So the breathing system's made up of a few different parts. So we have our upper airways, and that's our sinuses, pharynx, larynx, where we bring air in at the start. So through our nose, through our mouth. The breathing is an autonomic system, but we can actually override it by force, right? So if we decide we want to breathe faster, we can do it, okay? So it's fantastic in that sense, is that we have control. But what happens is over time, particularly with breathing disorders, is we start to see a little bit of dysfunction. We start to see irregular breathing patterns. And what that is the muscle control. So we change the way that our muscles bring air in, okay? Because we have restriction or because we have an obstruction in the lungs or in the airways, okay? When exercise increases, breathing must increase, all right? Because we need more oxygen. We need more oxygen in the tissues, in the working limbs, okay? So our breathing needs to increase. There's a delay between when our respiratory rate increases and when oxygen gets to the working limbs. Now, during that delay, we often see kids say, yeah, I'm very short of breath. I get short of breath quicker, particularly if they have asthma. There's more to breathing than just oxygen supply. Okay, so it is about the function. It is about how the muscles work, because they also feed back messages to the brain, not just the oxygen. How the muscles are feeling in the respiratory system, they tell the brain, yeah, I'm starting to feel weak. I feel fatigued. I need some help here, okay? And this is vital for delaying fatigue during exercise. So if we can strengthen those muscles in the lungs, they send less messages to the brain to tell the brain that they're fatigued. And then we feel less short of breath, which means we can do more exercise and we can do it for longer. So we can work at a higher intensity and we can work longer. When it comes to quality of life, when it comes to exacerbations, we're going to feel less short of breath. So it's a lot less scary. It's, we feel more in control. We feel more like we can do things. And that in turn, moving more, breathing better, does result in better outcomes with asthma. So what is IMT? It's breathing against resistance. So it really is the same, no different to lifting a dumbbell, okay? So it's dumbbells for your diaphragm. We're doing weight training for your diaphragm. Breathing muscles can be trained just like any other muscle, all right? That's an important point, because traditionally, a lot of the research was like in the 70s and the 80s, we didn't think that we could train our breathing muscles. Now we know that we can, we know that they get stronger. And we also know that if we train them for a certain period of time, we have a residual strength benefit. So if we do even short-term blocks, so let's say 12 to 24 weeks, we see residual benefits of that strength improvement for years following that. When these breathing muscles get stronger, shortness of breath decreases. Simple as that. So what I was just describing before in terms of the feedback the muscles give to the brain, we call that the metabo reflex. So in a nutshell, I'm going to explain it in the simplest way I possibly can, is that we're doing exercise or we're doing daily life, and the resistance from having inflammation increases our respiratory effort. So when we have to breathe against resistance, our muscles have to work a lot harder in our lungs, okay, to get air in. So our diaphragm's got to do more work and doesn't like that, okay? So it gets fatigued, and then it tells the brain, hey, I need more blood because I'm getting fatigued. So what it does is it pulls the blood from any other working muscle, so from like our legs, our arms. And so you can imagine that reduces the nutrients to those muscles. And what we get is a reduced capacity to perform sport, to perform daily life. I hope that makes sense. It's a complex system, but it can be simplified, and basically we call it blood stealing. So when the lungs muscles fatigue, blood is stolen from other areas of the body to go to the lungs, because obviously it's a priority system. I mean, if we don't have our lungs, as one of my lecturers used to say, would be DED. So we need those to be for life and for activity and everything that we want to do. So how does it work in the clinic? We train with a personalized inspiratory training device. I'm going to show you the one that I like in a second. It's usually 8 to 12 weeks as an adaptation phase. So that's something that we really need in terms of, a lot of people ask me about age, and really my question back is, can your child commit to doing, 20 breaths twice a day? Do you think they're going to be able to do that? Do you think they can self-manage? Do you think they've got the motivation? Okay. And really it just depends on the child. Like, I think a lot of the time, you have kids as young as 5 or 4 that can do this sort of stuff and it's no problem. But, for others, it's a bit harder, and maybe we need to wait some time before we can start doing training for them. It's an exercise device. It's not medication. I get asked all the time, is it medication? What medication's in it? It is exercise. That's all you need to think about. It is exercise. It does require effort. So it's hard. It's not easy. It is like any other exercise. We have to put the work in, but we get great results when we do that. So this is a device I like, the AeroFit. I'm going to show you a bit in a second. I'll try and turn my screen sharing off and jump to that. But basically, there's a lot on the website about athletes and performance, because actually, a lot of the research is not just in clinical populations, but it's in athletic performance. Now, when you think about the breathing system, it does make sense that, people that are suffering respiratory conditions, things that would help them probably do also help athletes, right? As a, logic sort of conclusion. It's a great device to start for beginners because honestly, it has these really low levels of resistance. It's really easy to breathe in and out of, and we can scale it right up to like elite athlete level if we need to. So we can start very, very low at an easy level, much like weights in the gym. You can start on level 1 and you can go to level 50. Okay. All right. So what I'm going to do, I might quickly just do this little summary and then I'll show the demonstration of the device. So what do we hope to achieve? Better tolerance to exercise, okay? That's what we want to see with these kids. We want them being active. It breaks your heart when you see kids that aren't able to perform, they're not able to play sport because they have asthma, they have symptomatic asthma. Not good enough, something that we can definitely help with. Engaging young people to start thinking about and setting themselves up for asthma self-management, okay? This is something they can be in control of. And as parents, we know it's something that you've got to get your kids to do in lots of things, right? It's anything where you can teach them to self-manage. It empowers them, okay? And really for this, it starts getting them to be really in control of their health, okay? And it's, in a lot of cases, asthma is lifelong. Decrease shortness of breath when symptomatic. Little typo there. Sorry about that one. So decrease shortness of breath when symptomatic. So when they are symptomatic, their shortness of breath will be less. And then better quality of life. So they're going to feel less short of breath generally, okay? And that's going to make them feel better. They're going to be less tight in the chest. They're going to feel less unwell. That's the key benefit that they get from this training. All right. I'm just going to stop sharing now my presentation. I hope you guys can all see me. So this is the AeroFit device, and it has a little mouthpiece. And so what we do is we just put that guy into our mouth, and I'm just going to show you a couple of breaths. We can actually do inspiratory and expiratory training, so breathing out. Not so necessary for the asthmatic population, but there are other features of this device. So we put it in our mouth. Nice big breath in, and then slow breath out. So you can feel that, you can hear the resistance. So you can hear that restriction that it provides on your breath as you breathe in. Okay, that's what we're, basically loading up. Now, we flick that through into different levels, and each level is a little bit harder. And so over time, we call it progressive overloading. So we overload those muscles, we strengthen those muscles by providing more pressure, more resistance over time. And then they get that gain that we're looking for, as mentioned in the slides. So that's everything from me. I think now's a good time to hand it over to Alicia to talk a little bit about interventions, naturopathic interventions, and how they can help your child and improve their symptoms.
Okay, can everyone hear me okay?
Yep.
Okay, great. Thanks, Joel. Thanks, Joel, and thanks everyone for joining today. My name is Alicia, and I manage the naturopathic clinic at City Osteo and Physio. I have around 15 years of experience as a naturopath, and look forward to sharing some of this experience with you today. So asthma is extremely common, and as you can see from the statistics here, 1 in 3 children will present with asthmatic symptoms before the age of 5. These symptoms may present as wheezing, coughing, chest congestion, breathlessness, and often in the very young, asthma can be very hard for doctors to diagnose. So when a doctor diagnoses asthma, there is a criteria of symptoms that are met. And this may cross over a little bit with what Joel was saying, but alongside the actual criteria of the type of asthma, usually the following are analysed as well. So looking at the actual risk of the disease, the causation of the disease, looking at the actual clinical history for that child, and the examination findings, and response to treatment. So all of this is actually analysed together. And when we see the actual findings or outcomes for that particular individual, that particular child, we can actually see then from this that asthma is actually not a single diagnosis, but a clinical syndrome of symptoms that we need to find out what the underlying triggers are for each child. And this is how naturopathic medicine would actually approach a child with the diagnosis of asthma. And, therefore we're talking about asthma, we're usually visualizing just the lungs independently. Most of us visualize that we're working with the lungs. However, when we implement, the art of holistic medicine or naturopathic medicine, we're actually speaking about a whole medicine approach to respiratory care and looking at the treatment of the whole child. And in addition to looking holistically at all of the symptoms, we need to look at the circumstances of when the asthma developed. You know, for that particular child, is there something that the child is doing that makes their symptoms worse for them? And from here, what we would do is dig a little bit deeper into the individual child's symptom picture and what it means for them. So, with the dramatic increase in asthma and allergies over a relatively short period of time, they say approximately over 2 generations, we can see that this obviously has nothing to do with genetics. Okay, that clearly these disease symptoms relate to the many and dietary lifestyle changes that have occurred over this period of time. You know, children do grow up quite differently now, where they're playing more indoors in the air conditioning, especially here in Singapore, and watching television or playing on their iPad. And this modern day way of life is a lot cleaner by nature. You know, children have less exposure these days to less germs in general, and playing in the dirt, and they have less contact with farm environments and usually less contact with animals in general. Today, our lives are lived quite indoors, clean, germ-free environment. So as a consequence of this, we actually become weaker against a lot of the microorganisms that we normally would encounter from our environment. And our immune systems don't get the essential exercise they would usually get. And what normally happens then is, you know, when we normally, our immune system normally would be exercised when it frequently comes into contact with these dirt and germs in the environment. And this actually makes our immune system become overactive and can present as asthma, allergies, eczema. And this is what we, one, you know, areas is what we call the hygiene hypothesis. You know, one large study, Swedish study actually found an association between pet ownership and reduced risk of asthma. So living on a farm was also found to reduce the risk. The study found exposure to dogs reduced the risk of both preschool children by 10% and school-age children having asthma by 13%. And this was quite a large study. It was among 650,000 children, and these findings were in the JAMA Pediatrics journal. So this particular study actually fits into the hygiene hypothesis really well, which favors this exposure to dust and dirt to improve our intolerance of common allergens. And but you know, we do need to be careful because we also need to identify that you know, these triggers can be different for each child. So about 80% of children with asthma actually have documented allergies. So what we need to address is to build up the overall stamina of and immunity of the child. And this, one way this can actually be achieved is not only through minimizing exposure of these allergens, but also through optimal gut health. You might be thinking, why gut health? Well, our gut wall actually houses about 70% of the cells that make up our immune system. And this is actually why asthma, allergies, poor immunity is associated with our digestive function. You know, our gut has a lot of roles to play, especially our gut bacteria and our good bacteria, and it is working hard to support our immune system, breaking down the food that we eat, absorbing nutrients, trying to reduce and keep out toxins. So, you know, as you can see from this particular diagram here, what this is actually trying to convey is that when we don't have healthy gut bacteria supporting our immunity, then our gut barrier can erode. And this is also called leaky gut. And this happens in the intestinal wall. Then we can absorb proteins or what we also know as antigens that don't belong in our bloodstream. So the body then targets these proteins with immune system antibodies, and then this eliminates these antigen antibody complexes with an inflammatory response. And this can happen either through the lungs, which is asthma, the skin, eczema, or with mucus, which can present as allergies. And so when we see this, this is a reflection of the same illness, the same dynamics, just a different site of illness. So this is what this diagram is conveying here, and how it can be triggered. So this is one study which found, well, it was conducted in 2009, and it found that 50 to 70% of children with severe atopic dermatitis will go on to develop asthma. And this is also known as the atopic march when we have this particular association. So from a naturopathic point of view, what we really want to do is fundamentally, we need to address the specific triggers for each child and avoid exposure to the offending triggers. So, you know, it would come as no surprise to all of you, I'm sure, that of course diet and what we eat plays a key role in our immunity and our respiratory health. So we really want to try to avoid foods that deplete our immune, like all the foods that children love to eat, or high in sugars and things like that, and reduce those as much as possible. Just all the obvious junk foods and high sugars that really deplete our immunity. Certain medications can trigger asthma, and also emotions and stress, so high anxiety in children, grief, you know, so we want to, you know, look at that and address any kind of underlying causes there. Homeopathics can be a nice one to help with grief in children. Is extremely gentle and can be used alongside any medications that they're using without any contraindication, which is fantastic. So just continuing on, these are other underlying lifestyle triggers. So, you know, from an environmental point of view, you know, pollens, dust and house mites, mold, sometimes fragrances, even latex rubber can be a trigger for some children. You know, using an air purifier could be supportive for some kids. Over control, as I was talking about previously, of the child's environment, including limited exposure to dirt, animals and people. And lastly, we're looking at, you know, only using antibiotics when necessary. Antibiotics are definitely a fantastic medication that we have, but it's trying to really limit it to the essentials, because either, you know, antibiotic use by the mother in perinatal period or by the child can make us more vulnerable to these allergies and asthma. Okay, so, you know, when we're looking at addressing the underlying causes, food allergies or sensitivities can actually be a contributing factor. So food allergies, or what we also call an IgE mediated food allergy, is when your child's immune system will react abnormally when exposed to specific foods. And as you can see on the slide here, I've actually chosen the really common offenders. So things like milk, eggs, wheat, and nuts are extremely common allergens. So children with this type of food allergy will react really quickly, usually within a few minutes or hours, and it can even cause, you know, extreme reactions such as anaphylactic reaction. Food intolerances, on the other hand, are usually less severe, and they don't trigger the dramatic or immediate reactions associated with the above food allergies. But they're every bit as real, with varied symptoms. It can be things like nausea, vomiting, obviously respiratory problems, what we're talking about today, brain fog, and skin reactions such as eczema. So we really need to try to identify if there's an underlying delayed food allergy sensitivity there, because people with lung conditions usually have a slower or lesser capacity to recover. So there's a greater need to take care of the body and avoid even these seemingly mild food reactions that are occurring in nature. So you can test for the delayed food allergy sensitivities. And this is usually done from 2 years and up, because this particular test is actually a blood test. So it can be quite hard to do blood tests in children. But the problem is with these delayed food allergies is that the symptoms appear, usually they're quite delayed. They take quite a while for the symptoms. It can be even days after. So it can be very hard to actually relate the food to the actual symptom. And so, you know, with this difficulty in pinpointing which food causes your problems, it can be an underlying trigger, which can be ongoing. So at the clinic, at City Osteo, we offer this food test, and this helps to take out the guesswork out of the healing, and to increase the immune response and decrease the inflammation in the body. Okay, so the other area from a naturopathic point of view is that failure to have proper good bacteria and varied microorganisms at birth can lead to an imbalance in our gut bacteria, and this depletes our immune response. So many factors can deplete our good bacteria. So as I was talking before about antibiotics, chlorinated water, poor nutrition. So working to restore the good bacteria actually helps with restoring our immune function. And as I was saying before, when we're looking at holistic health, this is one way that we can work holistically to help with respiratory care. The main thing that I would say with testing, so usually this, like testing for the gut bacteria and working with immunity through the gut, would normally be recommended from 3 years and up. And this is because usually at 3 years, we have a stable adult gut microbiome. So all of our gut bacteria is stable. So we can get a better idea from that particular age. So we have a particular microbiome analysis at the clinic where we use DNA sequencing to identify all of the actual bacteria that is in the gut. And it doesn't use the traditional culturing methods that often miss out on a lot of our bacteria, simply because we don't know how to grow all of our gut bacteria in a won't grow in a culturing method. So using these latest technology, we can get a more accurate understanding of what is actually making up the gut bacteria for this particular individual child. It allows us to see everything, not just what we can grow in the lab, essentially. So this is actually this is just to give you a quick snapshot of what this particular microbiome analysis looks like. So you can see here, as I was saying, that it allows us to identify all of the microbes, not just high, medium, or low of the ones that we know how to grow in a lab. And you know, from this, we can get a great understanding of if there's an overgrowth of a particular bacteria, or if we have low gut bacteria, what types of bacteria are in there? Are they associated with inflammation? Is there actually leaky gut present for this person? So it gives us a good idea of what we're actually dealing with. And then from there, we can look at when we sequence the microbiome, it allows me to actually target individual needs with strain-specific probiotics, and that allows me to give a comprehensive care and a treatment plan for the actual child, and focus on the areas that your child needs. Because really, when we're looking at healthcare, it should not be a one-size-fits-all approach. And from here, we can look at targeted or strain-specific probiotics and build up the immunity in the gut. So that's actually where I'm going to finish. Just a snapshot of you know, how we can actually, from a naturopathic point of view and food for thought, of how we can approach asthma from a holistic point of view. And of course, this can be altered for each child depending on how they're presenting. So I hope you found that helpful. That's all from me. Thank you.